If you have tinnitus, you may have come across some information that says stay away from alcohol. Or maybe you've noticed that after drinking a beer or wine, your tinnitus is either louder or softer. We're going to explore some of these questions today. My name is Dr. Ben Thompson, audiologist and founder of Treble Health, the tinnitus online telehealth practice. If you are new here, make sure to subscribe to my YouTube channel. And I want to share a new project that I've been working on. It's called tinnitusquiz.com. So if you head over to the website, tinnitusquiz.com, the quiz will ask you a few simple questions and provide guidance on the next step for tinnitus relief. It's a free quiz, and I put a lot of heart and soul into it. So if you want to try that before we start today's video, you can head over to tinnitusquiz.com. Now let's talk about alcohol, booze, liquor, beer, wine. We're going to see if it has any effect on tinnitus. Alcohol has been reported to worsen tinnitus in some people, but not all. There was a study of 100 patients that reported the effect of alcohol on their tinnitus. And out of those 100, 22% said that drinking worsened their tinnitus, 16% said that it helps to improve their tinnitus, and 62% reported no effect at all. The study also found that for individuals who noticed a reduction in their tinnitus, that they started to drink more, likely to find more relief from tinnitus. Now, that's not my recommendation. I'm going to talk about that, but let's go into more details on defining alcohol consumption. So a typical drink, one drink is defined as a 12-ounce beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor. Light drinking is defined as about 1 drink a day for women or 2 for men. Heavy drinking is considered over 3 drinks a day for women and over 4 drinks a day for men. And that's a good just frame of reference to understand, are you drinking lightly or are you drinking heavily? While changes to blood pressure are usually temporary with light to moderate alcohol consumption, increased blood pressure can lead to changes to blood circulation in the inner ear, which is often the cause of many people's tinnitus. If you are drinking heavily, then cutting back on alcohol consumption can lower your blood pressure. Alcohol also has calories, and weight gain is a risk factor for high blood pressure. Now, on the other hand, some people find that alcohol and tinnitus do mix well in the sense that alcohol has a positive effect on tinnitus because alcohol in the temporary moment may reduce stress and increase quality of life in other ways. And we know that the reduction of stress and other mental health benefits can have a big impact on tinnitus. So of course, there's many natural ways to reduce stress, and alcohol shouldn't be your first go at it. Try things like exercise, time with friends and family, guided breathing, meditations, outdoor recreation, sound therapy, and much more. So don't just go to alcohol as a quick way to reduce stress if you can. So we all know that alcohol can affect tinnitus, but can alcohol cause chronic or long-term tinnitus? From the research, there's essentially nothing to suggest that it does. I think a big problem or question people have in our community is, I have tinnitus. I read somewhere that I can't drink alcohol. What should I do? Now I stopped drinking because I don't want to make my tinnitus worse. There was a systematic review of 11 studies, and the research showed that there was not a strong link between alcohol and tinnitus. So alcohol does not cause persistent tinnitus. And if you have light to moderate alcohol consumption, then you're not going to make your tinnitus worse. So that's probably safe for most people. My advice is that if you notice that alcohol makes your tinnitus worse, then you might be one of those in the minority where the alcohol makes your tinnitus louder. In that case, I would try to have light alcohol consumption or no alcohol consumption if possible. But for most people that were surveyed, as well as from the research that looked into the study, having light to moderate alcohol consumption is not associated with an increased risk of tinnitus or developing tinnitus. Overall, alcohol does not appear to directly cause tinnitus. So for most of you, don't have to be worried. It's okay to have light to moderate drinks. My name is Ben Thompson with Treble Health. Great to see you here. Make sure to head over to tinnitusquiz.com and get started with that free assessment. Thanks so much. See you soon.